macrosomia is a potentially dangerous condition that automatically creates a high-risk pregnancy. The reason for this is very simple. When a baby is overly large, it makes it much more difficult to pass through the small birth canal, making a normal vaginal delivery very problematic.
You may be wondering, what is macrosomia? Fetal macrosomia is a condition that presents severe implications on both maternal and child well-being. According to Mayo Clinic, nationally ranked as the #1 hospital, macrosomia is defined as a newborn who's larger than average. It is a newborn who is over 8 pounds and 13 ounces, regardless of his or her gestational weight. Good afternoon, my name is Christian Georgiou, and today I'll be talking about excessive weight gain's correlation with increased risk of macrosomia. This leads to my research question. To what extent does the prevalence of excessive weight gain lead to an increased risk of macrosomia in 21st century United States? This question opens up to a comprehensive understanding of the complex interplay between excessive weight gain and macrosomic risks. This leads to my thesis. The prevalence of excessive weight gain in pregnant mothers leads to an increased risk of macrosomia and also has negative consequences on both the child and maternal well-being. 3 key attributes to this can be the excessive transfer of nutrients, the excessive transfer of glucose, and insulin resistance. To begin with, it is crucial to note that weight gain is necessary for a healthy pregnancy. However, University of Tennessee Health Science professor Rebecca Krukowski states, excessive gestational weight gain is a key modifiable factor that determines pregnancy complications such as preeclampsia, gestational diabetes, and macrosomia, of course. This is why gaining the right amount of weight is imperative during pregnancy. A study by Professor Barbara Adams from the University of California, Berkeley gives a table depicting weight gain during pregnancy. As we can see, 883 have inadequate weight gain, 1,008 have adequate, and 1,654 have excessive from the study. Approximately 46% of pregnant women face excessive weight gain during pregnancy, and understanding the complications such as macrosomia are necessary to having safe and good pregnancy. According to Professor Carolyn Rockhill from the University of Emory, fetal macrosomia presents many risks on both maternal and child well-being. Maternal risks include longer first and second stages of labor, emergency cesarean, also known as C-section, postpartum hemorrhage, which is mother bleeding. Fetal risks include childhood obesity, infant death, also known as stillbirth, and shoulder dystocia, where the child's shoulder gets stuck during delivery. According to this graph depicting macrosomic rates with weight gain of pregnant women, we can see that the dark red line depicts women gaining over 40 pounds, which have the highest risk of macrosomic rates. Secondly, the green line depicting 31 to 40 pounds of weight gain is the second highest, and it follows. This correlation can be shown directly with the increase of weight gain and the increase of macrosomic rates. This can be depicted by the overnutrition, which leads to an elevated levels of nutrient transfer such as amino acids, fatty acids, and glucose. This understanding of excessive weight gain from overflow of nutrients connects to the increased risk of macrosomia. Furthermore, this correlation cannot be denied. This table from Professor Maisa Figali from the University of Pittsburgh depicts macrosomic percentage with women who have gestational weight gain and don't. As you can see, 11% of women who don't have gestational weight gain suffer with macrosomia compared to the triple, which is 32% in pre-diagnosed excessive gestational weight gain. And the risk factors follow, all increase for women with an increased risk of macrosomia. University of Hawaii professor Jean Kim and colleagues explain this correlation due to maternal insulin resistance, where the body's cells become less responsive to insulin's actions. Insulin resistance is commonly associated with obesity and is exacerbated during pregnancy due to hormonal changes. And this issue depicts excessive weight gain's correlation to macrosomia due to insulin resistance. As we can see in this picture, a pregnant woman is testing for diabetes. This is due to diabetes' great effect during pregnancy. According to Professor Akriti, managing gestational diabetes is paramount in preventing macrosomia. Studies have shown that up to 45% of babies born to mothers with gestational diabetes develop macrosomia, compared to the 11% in healthy mothers. The overflow of glucose is a factor of macrosomia, so managing maternal blood glucose levels is paramount to having a decreased risk of macrosomia. In the College Board stimulus provided, Simone Biles, a 4-time Olympic gold medalist, took the courageous decision to drop out of the 2020 Olympics for her well-being. This truly resonates with the challenges faced by mothers who are suffering excessive weight gain. Both Simone Biles and pregnant mothers can relate to acknowledging their personal vulnerabilities and seeking tailored solutions. And at the end, they'll both be able to overcome it with the right mentality. This leads to my proposed solutions and limitations. First, we have healthcare guidance, which is seeking guidance from a medical professional. However, a limitation to this can be accessibility. Not everyone has good access to healthcare, and it takes a lot of money to have good healthcare. Another solution can be behavioral interventions, such as diet and exercise. But a limitation to this can be motivation, especially with a lot of women dealing with perinatal depression during pregnancy. Another solution is public health education, like forums and campaigns, but a limitation to this can be reach and engagement. This leads to my solution. Alongside all these beneficiary solutions, I believe prioritizing behavioral interventions targeting diet and exercise can be the most effective. Diet is very influential on how much weight is gained, and of course, exercising is healthy for all people, including pregnant women. And so decreasing excessive weight gain through this solution can help decrease macrosomia overall. Thank you.
Good, because you'll be off the camera. All right, Chris, 2 questions for you. First up, what information did you need before you began the whole research process, and then how'd you use that information?
So I needed information talking about excessive weight gains, correlation on any specific factors. At the beginning, it was hard to find a specific correlation between excessive weight gain and macrosomic rates. However, after finding excessive weight gain's effects, you can build a correlation due to the effects because they are causes of macrosomia as well. So overall, I just needed to find a good effects from excessive weight gain to build a correlation with macrosomia.
All right, and if you had more time, what additional research would you conduct?
I would definitely do more research on the risk of stillbirth from macrosomia. I think that child death is the worst thing that can happen in any situation. And proving this can be very paramount if I build a good correlation between macrosomia and the childbirth.